Hello, everybody. My name is Nick Corrigan, and I'm chairing the webinar today. Great welcome to many of you. It's so great to have so many people. We're on over near 160 and counting right now, so it's still going up. So I'll periodically keep welcoming people as they come in. It's really great to have so many people logged on for a very timely and exciting discussion. It really does seem as if webinars are the learning tool whose time has finally come. Our strength at Business in the Community is our ability to convene experts from across the private, public and third sectors in order to share experience and learning that promote responsible business to our members and to UK organisations more broadly. The title of this webinar is Supporting Mental Health During and Beyond COVID-19. And we're bringing it to you in partnership with two organisations that we work closely with on our wellbeing campaign areas, the Society of Occupational Medicine and CIPD, along with a guest from King's College London. The webinar will be recorded and you'll be sent a link out after the webinar along with the evaluation, so you'll be able to share this with your peers or watch again if you'd like to. One of the things I love about my role as Head of Training at Business in the Community, that's a different picture of me with a different shirt on. One of the things I love about my role as Head of Training and Business in the Community is coming into contact with amazing experts who create positive change in the world around us, and today's no exception. We have people whose action have improved the well-being of military, NHS workers and business leaders. The work they're doing and the guidance they're creating is going to help our companies, communities and families get through this pandemic with the least impact on our mental health as possible. Our Business in the Community, alongside our members, we're delivering an emergency response to support employees, communities and businesses during the acute phase of COVID-19. And we're also creating and sharing information, practical help and guidance to see us all through the recovery phase and create a new normal that has responsible business at its heart. The people that you're going to hear from today, in order of appearance: Louise Aston, my colleague at Business in the Community, the Wellbeing Director. She works to create environments where individuals and organisations can be their best. She's a creative one of the team here. Her background is as a textile designer for fashion, and she transitioned from being a transition buyer at M&S to taking health into fashion by designing a sun protection children's swimwear collection for Government Skin Cancer Protection Unit. She lives off Portobello Road in West London, but is currently holed up in a remote cottage in Norfolk, where she went to stay with a friend in March, but then got stuck when lockdown happened. Professor Neil Greenberg is a Professor of Defence Mental Health at King's College London. He's a consultant academic, occupational forensic psychiatrist based at King's College. Neil served in the United Kingdom Armed Forces for more than 23 years and was deployed as a psychiatrist and a researcher to a number of hostile environments, including Afghanistan and Iraq. At King's, Neil heads on a number of military health projects and is a principal investigator with a nationally funded Health Protection Research Unit. He also chairs the Royal College of Psychiatrists Special Interest Group in Occupational Psychiatry. Neil has published more than 250 scientific papers and book chapters and has been the Secretary of the European Society for Traumatic Stress Studies, the President of the UK Psychological Trauma Society and Specialist Advisor to the House of Commons Special Select Committee. Peter Cheese is from CIPD. He writes and speaks widely on the development of HR, the future of work, and key issues in leadership, culture, organisation, people and skills. Prior to joining CIPD, he is a chairman of the Institute of Leadership and Management and a member of the Council of City and Guilds. Up until 2009, he had a long career at Accenture, holding various leadership positions, culminating in a 7-year spell as Global Managing Director, leading the firm's human capital and organisational consulting practice. Finally, Nick Pahl, CEO of the Society of Occupational Medicine. The SOM is the largest and oldest nationally recognised professional organisation of health professionals with an interest in health and work. Their patrons are Lord Blunkett, Dame Carol Black and Sir Norman Lamb. Nick has 5 kids and a wife who's a Metropolitan Police detective, and he practices one of the few sports that's still possible to enjoy in lockdown, and hopes that his 22% win rate in the London table tennis division will improve once he can compete again with people that are not just his family. So this is the order of the day. Louise is going to be setting the context and setting BITC's interest. Neil's going to cover the importance of a proactive approach to traumatic experience. Peter's going to bring us back to a more common experience of the workplace, and Nick's going to help us all imagine what returning to work might look like and what we might want to start doing now in order to prepare for that. We've got about 20 minutes for Q&A if our esteemed panel manage to keep to the very tight slots they've been allocated. So please do send in your questions as you go along. So hopefully you can see the chat box on your screen, pop your questions in there, and it'd be really helpful to note who your question's for. So while people are speaking, we'll be gathering those, putting them together and coordinating some great questions for you for that final session. So I think I've probably overrun on my 5 minutes, and I'm expecting everybody else to keep to time. So let's move on. Let's start with Louise.
Hi, everybody. Delighted to be here this morning, and thank you very much for joining us. I'm going to start with actually in terms of ensuring that well-being remains in the fore during and beyond this crisis. So next, please. So like any crisis comes danger, but also opportunity. And there's certainly already been some learnings from the acute phase to inform the recovery phase of the pandemic. Wellbeing has absolutely come to the fore along with the environment during this time. And, you know, basically the the coronavirus pandemic isn't just a physical health pandemic, it's also potentially a mental health pandemic as well. But also some good things have come because the pandemic has actually been a catalyst for bringing mental health to the fore. And you could say that actually COVID-19 has actually done more to accelerate mental health in the last few weeks than years of campaigning. We know that mental health is on every employer's agenda and frankly has been elevated for the first time on a parity with physical health and safety too. We've seen a huge cultural shift with employers adopting strategies to support their people's physical and mental health to stay well and working during the lockdown. And what we've also really seen is the importance of empathy, honesty, and compassionate leadership and management, which have emerged as essential qualities in terms of managing people remotely and during difficult times. And employees have really appreciated the honesty of employers about the necessity of furloughing people, and actually by being straightforward and honest has made things a lot more palatable. Next. So in terms of seizing this moment and while we prepare for the recovery phase, is building back better using the lessons learned from the acute phase to inform our new normal is crucial. And it's also a massive opportunity to capitalise and ensure that mental health remains a priority as we move forward to the new normal. So ensuring we put people at the heart of business alongside obviously the huge kind of economic downturn, you know, it's basically we're looking like the worst economic downturn since the Great Depression. But we know that empathy, honesty, and compassionate leadership and management have shone through in the crisis, and they're not a luxury, but a necessity along with the economic recovery. So everybody's talking about easement, which is about the return to physical work locations as kind of things loosen up, about social distancing, and the impact of social distancing will have a profound mental health impact as a crisis of anxiety as people start to return to physical places of work. And we think that the return to work is the key moment that we really need to prioritise mental health. And obviously physical health is important, but we must obviously consider the impact on mental health. So it could be very hard to return to work in terms of what people have been used to around social distancing and isolation, unleashing fears, reigniting latent mental health conditions like anxiety and OCD. And, there is also the danger of a painful legacy of COVID, maybe a generation of people who are too scared to shake hands or hug. Next. So in terms of the employers who are responding to the acute phase well, are really actually taking this whole person approach that we advocate in BITC's Work Well model. And we've seen, in terms of the strands of anxiety, obviously there's the physical health, this whole person approach, protecting oneself and loved ones from catching the virus, obviously to do with mental health, the anxiety, lack of control, routine being upset is deeply stressful. And we've also obviously seen the impact of social isolation, loneliness, the world of one, and where people actually can't cope with it and are pushed possibly into even contemplating suicide. And then, of course, there's the financial stress. And then I'm just going to mention next. Last October, Business in the Community, in partnership with the employers, the Thriving at Work Leadership Council, launched the Mental Health at Work Commitment, which was next, underpinned by 6 standards that are evidence-based. It's just to say, is very shortly is BITC are launching employer actions to support the 6 standards through a COVID lens. So those standards that underpin the commitment are still incredibly important, and you'll be hearing more from us. So thank you for now. Over back to you, Nick.
Thank you very much for setting the scene there, Louise. So without further ado, straight over to you, Neil.
Thank you very much. Thank you very much also for inviting me to take part in this webinar. Hopefully the slides will move. No, I can't make the slides. So could you put through to my first slide, please? Thank you. And then we could go to the next one. Thanks very much. So in terms of trauma, psychological trauma, clearly a lot of essential workers are currently facing really challenging situations at the moment. Most of us, whether we're essential workers or not, are also hearing about trauma very regularly on the media, and indeed, unfortunately, it's affecting some of us more directly, particularly with family members and friends. It's important to recognise that in terms of what a traumatic event is, it's not just actually things that happen, it's also things that might happen. And this definition here, that comes from a psychiatric textbook that is regularly used, recognises the fact that threatened traumas actually can also have a really big impact upon people's mental health, as well as things that really happen. And that's important to recognise for people who are either at work or coming back to work, because many people are likely to feel that something could have happened to them or their loved ones, and that also can affect their mental health. And there's also a recognition on the very last piece of this definition that workers who are repeatedly exposed to challenging and traumatic events in the course of their work are also at risk of suffering with mental health problems such as post-traumatic stress disorder, although other problems as well. Next slide, please. So this is a slide which basically shows what the normal recovery is after a single event. And of course, we have to recognise, I'm sure we all do, that this is not a normal single traumatic event. It's a prolonged period of time. But this gives us an idea of what recovery looks like in people. The slide actually represents people who used to work for the Leeds Permanent Building Society, who were subject to armed robbery. And what this shows is that in the first few weeks after a traumatic event, quite a lot of people have distress symptoms. They may be jumpy, they may not want to talk about it, they may have poor sleep, or be irritable or poor concentration. Importantly, though, you can see that actually the majority of people recover pretty quickly over a period of a few weeks. And then in this particular case, you're left with about 10% of people who seem to have a persistent problem. And they're the ones who have probably got a mental health problem, such as post-traumatic stress disorder. What's really important to note is that it's really normal, and it's not pathological, to experience quite a lot of symptoms early on, and that most symptoms recover without the need for any professional intervention. I therefore think there's a really big need and really big potential impact of making sure that as we begin to get back to whatever the new normal is, that we keep up the high levels of social support and camaraderie and sensitive and compassionate management that I think have been going on so far. The evidence is that the things that really improve your mental health in those early days are all the normal coping strategies that we're used to, going for a run, a glass of wine, talking to some people you know, letting time pass, engaging in pleasurable activities. Next slide, please. So if you could press the slide a few times, I don't think, oh, maybe a few times. Yeah, so most of us kind of go along at about 70%. There's a few Energizer bunnies out there who sort of do 90%, and a few what are called bottom feeders that seem to get away with not doing very much at all. So if you've got someone who is involved in a really big major trauma, then what can happen is they can go from functioning really well to actually functioning pretty poorly in a short space of time. So this might be that if you happen in the current climate to suffer a bereavement because of COVID, or because something really unpleasant happens at work if you're an essential worker, then you may get affected straight away. But actually what often happens is that people begin to go downhill gradually over time with repeated trauma exposures. And then what happens is something relatively small, the final straw happens, and then they find that they fall apart. And everyone would sort of be a bit surprised why an individual who previously was doing okay would fall apart from something quite small. And the reason is that they've been going gradually downhill for a while, and no one's been asking them how they're doing, or if they have, they've just said that they're fine. And of course, we know FINE stands for fucked up, secure, neurotic, and emotional. And it is asking someone how they're doing and getting a fine as an answer is not a mental health check. It's important to say that although I'm talking mostly about post-traumatic stress disorder, there are lots of other mental health problems that occur after trauma. And our national body, the National Institute for Health and Care Excellence, doesn't get hung up on whether someone's got PTSD or not. It uses the term clinically important post-traumatic stress symptoms. So if it looks a bit like PTSD and someone's suffering, you should get on and treat anyway. So in terms of from a business point of view, obviously the best thing you can do is to prevent people having problems in the first place. I think it's really important, if you haven't already got one, to make sure that you have a really good, robust, evidence-based policy in place, which basically puts staff's mental health, particularly in relation to the current outbreak, front and center of your business plan. And I quite like that phrase, is that people have to know that you care before they really care what you know. And I think there has been in the past sort of situations where people have nice policies that look nice, but actually they're not applied, and therefore no one really takes much notice of them. The next thing that is important is making sure that within the workplace that you've got really supportive teams, and that your junior supervisors are really able to have a psychologically savvy conversation with their staff members. This is data we gathered from Iraq in 2009, and British troops. I won't go into the detail of what of quite what we did, but what we were looking at is what was the impact of having good teams on people's mental health. And the scale you can see along the side there, the PCL score, is a measure of traumatic stress symptoms. And what this clearly shows is probably what you already know anyhow, which is that if you have supportive teams, it not only makes you feel good, but it also protects your mental health. So looking out for each other, buddying up and checking on each other is definitely a good thing. However, where the real impact is in the attitudes and the training and the experience of the junior supervisory level leaders. So this is the person who's immediately above you in your structure, the person who influences your day-to-day life quite regularly. This is data looking at leadership in Afghanistan and British troops in 2010. There's about 1,500 troops in this sample. And what you can see is roughly about 3% of those troops who are on deployment probably have PTSD. That's not surprising, they're in a war zone. However, you can see there's a 10-fold difference in the rates of probable PTSD between the troops who had poor leadership and the troops who had good leadership. So actually the real biggest influence on whether someone was unwell when they're in a war zone isn't how much trauma they see. It's very much about how well they feel they are supported by the person who's immediately looking after them. And therefore, if you're looking for the single best bang for your buck, it's making sure that your junior level leaders really are able to have that psychologically savvy conversation. Now, many organizations are interested in trying to use mental health screening as a way to try and detect people who have mental health problems. And it's fair to say that in military forces, most militaries, apart from the UK, routinely screen their troops when they come back looking for mental health problems. In 2009, the US military first looked at their data from their screening program, having screened over 1 million troops, and they found quite a worrying finding. What it showed was that troops who had been screened, found to have a mental health problem and then advised to get help, did less well if they went and got help than if they ignored the advice. And that led them to be worried about what impact the screening was having. And so what happened was that they funded, I'm sorry, I'll go back a slide if I can. They funded us in the UK to do a large, proper randomized control study of screening, looking to see whether we could get screening to work in the UK. And the reason they funded us to do it is they couldn't do it in the US because they couldn't get a control group, because Congress wouldn't allow them to stop screening troops to have a comparison group compared to screening. So we did a big trial of about 9,000 troops. It cost $3 million. We run over 3 years. We followed people up about 15 months afterwards. And we found that screening made no difference. It didn't improve mental health, and it didn't improve people's likelihood of seeking help. And the reason is that other studies we've done also tells us, again, what we might already suspect is that inside an organization, people don't tell the truth. Even when you reassure them that actually that you're really trying to look out for their health, they just don't believe you. They're worried what will happen with the information, and they're worried what other people will think about them and how it will impact on their career. So within an organization done internally, screening is really unlikely to be of any benefit. And worryingly, what it might do is falsely reassure people that employees are okay when they're not. What we do know seems to work pretty well is making sure we reinforce those bonds between people. And peer support training is one of the ways that seems to work. And there are lots of different types of peer support processes out there. But making sure that you can have a program which really looks at how people are doing within the organization and upskills peers to be able to identify those who have difficulty can be really useful. Peers are obviously available wherever an incident happens because they're in the workplace. You're not flying in experts. And also because they're not medical, they may be less stigmatizing. So one of the processes that I've spent a long time myself sort of implementing and using and helping other organizations do is trauma risk management, TRIM. It started in the British military in the late 1990s. And the idea is to train people across the organization, a bit like you might for normal first aid, so that they can support each other, particularly after traumatic or challenging events. And you need people spread throughout the organization so that the senior managers can speak to a TRIM practitioner who's a senior manager. And again, at all different levels, you've got people there. The reason why this is important is that we know people really prefer to speak to people like themselves rather than people like me. I'm a psychiatrist. And so this is a study, again, of troops, and we asked them when they came back from deployment, who did you speak to about your experiences? And perhaps it won't surprise you to know that 97% of people spoke to people like them, who had the same experience and who spoke the same sort of language. Only 8% of people came to see people like me, medical or welfare services. So I know many organizations have welfare or occupational health or an employee assistance program, and that's great. But actually, that's not where most people who are distressed go to. Mostly they go and speak to people who are just like them. And that's the benefit of having a peer support system, is because you train people who are just like them how to actually have a proper conversation and be able to identify those who need additional help. This is the TRIM checklist. I won't go through all of them, but what I can tell you as a scientist and as a clinician is that the risk factors you can see there are all ones that are drawn from the scientific literature. So for instance, we know that people who feel ashamed about their behavior are more likely to have psychological difficulties. That may be particularly relevant at this moment in time for people who actually felt they should have done more, or people who were faced with morally challenging decisions in the course of their work and aren't sure they did the right thing. That unfortunately is likely to be happening quite a lot at the time, at the moment. In terms of, I'm slides. What's important to say is what you're not trying to do is turn peer supporters into mental health professionals. They're not counsellors, they're not therapists, they shouldn't go around giving people hugs, particularly not at the moment, obviously. And this is really very much about making sure that mental health support and monitoring is readily available in the workplace, and it's embedded within people who are likely to be approached and who can have a easygoing, non-stigmatizing conversation. And what we know is that peer support, when we look at the evidence, we've done over 13 trials now and papers into the use of TRIM, is that this is not penicillin for trauma, but it's a very useful way of helping people get simple support, good management, good sensitive, compassionate support from colleagues. And it's also a very good way of making sure that people who really need professional help like me, from people like me, go and get it. And it's a useful intervention, and importantly, doesn't cause any harm. We also know that for those people who unfortunately do need care, then it's really important that they get evidence-based care, which is delivered by people who have the right skills and training. And just to finish, there's a lot of people out there who sort of claim really well-meaningly to have some sort of new intervention, a fast trauma cure, but often these people end up being snake oil salesmen. And what we really need to do is to make sure the first time someone goes and gets professional care, that it's got a really good chance of making them better. Thank you.
Thank you so much, Neil, and I'm sorry I had to put my video on just to give you a wave, so we did have time for the other guests. It's really really amazing to hear you bring that kind of military experience and make it so relatable for those of us that are in workplace contexts very far from conflict and trauma. Thank you very much. So next we have Peter, Chief Executive of CIPD. Are you with us, Peter?
I'm with you, and good to see you, Nick. Thanks, Neil, as well. And it's great to be part of this webinar. We work very closely with BITC and the Society of Occupational Medicine. We're all part of the Mental Health at Work and Thriving at Work Leadership Council and so on. And as I represent the CIPD, so the professional body for HR and people development, we have a very large professional community of around 160,000 HR leaders and practitioners here and elsewhere. Just to move to the first slide, I mean, we're all in this extraordinary context, aren't we? And a lot of people have described this crisis as one which is really beginning, of course, with a human dimension to it. And it's very different from things like the global financial crisis. It's obviously very different in magnitude and scale. But for our profession, it's certainly put HR very much in the sort of eye of the storm in so many ways. I was talking to a chief executive recently who said that he had spent more time with his head of HR in the last 8 weeks than he had in the last 8 years, which probably says something about what was going on in the previous 8 years as well. But the reality is this is very much centered around us as humanity and as individuals. And all I was trying to show on this one is that this first slide is that, of course, it started as a health crisis, but with this lockdown, and the fact that I think, you hear these stats like something like half of humanity are in some form of lockdown, it is clearly also a massive social crisis. And of course, it is a very profound economic crisis, as Louise said. I mean, the debates now about not just recession, but potentially depression as well. And all of these things ultimately are impacting at the very heart mental health. I mean, if you take the social side of it, I mean, the fact is people have described this as the biggest experiment, not that we have the choice, but the biggest experiment in home working ever conducted. But it's also in a very, very bizarre circumstance, isn't it, where the normal outlets we would have of social connection and reinforcing our social well-being in those terms, of course, are very much denied to us. So it's just to recognize what has already been said, that at the heart of so much of the thinking now is mental health. And what we see, both interestingly leading up to the crisis, there's been a lot of good work done on mental health, and it has become a much more central agenda for business. But this is really accelerating, and in all of the surveys that we've done, 70% of organizations said amongst their very top challenges was the mental health and well-being of their people. So it's encouraging to see them thinking about that. The question is what are all the different ways which we have to act upon it. And Neil gave a very good whole series of links that I want to pick up on. So we can move to the next slide. It's also understanding that well-being is from lots of different perspectives, and to build on that context thought, you know, we've often, if we're honest, thought about people only really in the work context. They come to work, whatever they do in the rest of their lives is not my business, but actually, of course, it's all part of the holistic way that we have to understand people. And in this context we're in now, I think we're all appreciating far more about the holistic nature of our people, of our teams, of our workforces, even the very fact that we're literally looking into each other's living rooms, and we're naturally having to engage more with the debate about how are you, what are your other constraints. So this table is just trying to illustrate some of the things that are going on. So first of all, in the work context, we are seeing very changed workloads. For some, in some sectors, we're talking a lot about essential workers and so forth, a very increased workload. But even within organizations, it isn't all just one thing. For some, you may find that you've got a very increased workload on maybe the customer services side of your business, whereas other parts of business are very much reduced workload. So how do you balance that? How do you make it fair? And how do you make it fair if, for example, you were saying you're going to furlough some of those people who had less work, but that then piles more work onto the people who are remaining and puts more stress on them? You've got other questions like new joiners, of course. Have you got proper support for home working? And that is not just technology, it's also the physical setup. We do have a duty of care and responsibility to our people when they're working, wherever they're working. And we have to understand some of those things as well. And, you know, how we're all having to learn new technologies, and it's creating cognitive dissonance. Am I on the right thing? Have I pressed the right button? Do I know where to find the information? All those kind of things. And of course, moving to more of the self and family things, which are becoming so much more apparent during this crisis. So as has already been said, you know, my individual worry about my own health, my own exposure to the virus, the dealing with isolation and mental resilience, and we're all in different circumstances like that. We all know that we have members of our workforces who may well be living on their own, not only living on their own, but in quite limited circumstances, and finding it very hard to separate work from life and have that break, have those boundaries, and that creates a huge amount of mental strain as well. A lot of anxiety because of all the change going on and what is going to happen next. Am I still going to have a job? And if so, what's that going to look like? The financial worries, which is we've already called out in terms of the economy. And we already knew coming into this that, interestingly, when you think about well-being, you think about physical and emotional and social, but financial well-being has also been talked about so much more as well. And that the number of people who have very little financial security in this country is really alarming. It's in the tens of millions of people who have literally only savings in their orders of hundreds of pounds and get extremely anxious, therefore, when they see any kind of threat to their financial income. And of course, we are seeing things like sleep patterns changing. And again, it's been interesting. There's been so much more debate about the importance of sleep to our mental health and well-being leading into this crisis. So we need to be thinking about those things as well. And of course, all of the family context, again, all different. You know, I'm a lone parent. If I got to worry about my children who I can't now send to school. So without, you know, drilling into every detail, we can all see that this context has created a whole new set of pressures for us. So if we can move to the next slide, as we think about well-being, it's also seeing well-being in a wider context. I mean, as Neil said, well-being is not just how are you, great, you're fine, move on. It's much, much deeper than that, and we'll explore some other thoughts on that. But it is also seeing it in the context of all of these things about how I'm trying to support my people. And this is to illustrate again that well-being is not just, you know, the soft side of looking after people or being politically correct or something like that. It is absolutely fundamental to people's performance and their ability to perform effectively in organizations. And I do think we've forgotten some of that in the intervening years. I mean, if I go back to the history of the CIPD, 100 years ago, our profession started as the Welfare Workers Association in companies like Lever Brothers and Cadbury's and Rowntree's, who are still here as businesses, and they talked so much more then about welfare and well-being. You know, the good news is, as I said, we're talking about it much more and have been talking about it much more, and I profoundly believe, as Louise said, that this crisis will force this to the very center of the agenda, but it is seeing its connection also to how people perform, how we support their development, and how we do things like feedback. And particularly, of course, in a remote circumstance, we're all having to adapt and adjust. It's very hard to have, perhaps more difficult conversations with people about performance when you're dealing with them remotely. You can't sense every way that they're reacting. And as soon as they're off the call, who knows what's happening? So we have to adjust those other aspects of what would normally be seen as part of the ways in which we manage our people during these times. So if we can move to the next slide. Then it is about thinking these different aspects of wellbeing support. And as Neil has rightly called out from all of the evidence through his kind of research, this is a lot about the context that we're providing support to our people, about the individual team leadership, about how they're connecting with their colleagues, about who they're talking to, all of those sorts of things. And we know that we've been steadily building up in many organizations some of these support mechanisms. There's been a lot more debate and a lot more progress on things like mental health champions, things like mental health first aid, about employer assistance programs, about, obviously in the world we're in now, home working setup support, supporting new joiners. But it is also how we continue to use communication channels, how we guide our managers, because if we acknowledge, and as Neil has called out, one of the most critical elements in all of this is how are managers working with their teams? How are they supporting them? And let's not forget either that the people who are often under the most stress are actually the managers. There's great work done by the Centre for some of the evidence-based stuff on wellbeing, which shows that through our lives of wellbeing, we go through highs and lows, and interestingly, generally our sort of lows are more around our mid stages of our lives, where we have all these pressures of perhaps young families, bringing out families. We're in the mid stages of our careers. We're often got management responsibility. We may be sitting somewhere between the leadership and the front line of the workforce. And those are very pressured situations to be in. So we do need to support the managers. We need to give them the kind of guidance as to how to communicate with their teams, particularly in these sorts of times, but also how they can support themselves, because you can't support somebody else if you yourself are not in a good place. We've also opening up many more channels of communication. I mean, the reality, even as I think about across my own organization, is that the communication channels that we're using, interestingly, have been enhanced, because we're all having regular touch-ins, group or team huddles every day. We're communicating more. We're asking more about how people are feeling. We're pushing more of this stuff out to our people and encouraging them to come back to us as well. And those are things which we've had to do per force. And there's that great saying, necessity is the mother of invention. And I think we have done more of these things during this time. And these are things that we need to take forwards and make sure that we are continuing to engage in these ways with our people, and acknowledging that mental health has been put much more forcibly on the center of the agenda, but it needs to stay there. It is so fundamental to good work, to well-being and people's livelihoods and living, and recognizing that fundamentally work is a human endeavor. It is also a social endeavor, and we've got to trust our people. We've got to make sure that they're aligning to purpose, and all of those other ideas which support this notion of what is good work. So finally, let me just close, if we could go to the next slide, is there is a lot of support for some very, very good stuff out there. Louise has already touched on things like mental health at work, and the Mental Health Work Gateway, and the 6 guiding principles and standards, which we're all working towards. As I said, that's building a momentum that have been growing over the last year or so, and fantastic work with the mental health charities like mine. We're part of that. Nick Pahl and his organization are part of that. BITC is all part of that. So that's a great resource which we're all sharing. And each of us individually, I know, is working very hard with our channels to provide great guidance and support. So do go to that, do use it, because it's well evidenced, it's well researched, and it gives you a great starting point. So let me leave it there, Nick. I think, as I said, this is a context which is very unique in many, many ways, but I think it is drawing to all of our attention the very centrality of the idea of humanity at work, of compassion at work, of treating people like human beings. And that is what we've needed to do for many years. I think we've improved on it, but I think we can use this crisis to come out the other side stronger in the way that we create that real cohesiveness and support to all of our people and recognize all of their needs, not just in this time, but as we go forward. So thank you very much.
Thank you, Peter. I love that connection from what you're saying there about our compassion with the people that work with us, and what Neil was saying earlier about people have to know that you care. So it's not just enough to have compassion, but they have to sense that as well. So those two pieces are coming together really nicely. Thank you, Peter.
Thank you.
So Nick Pahl, do we have you? Should we swap videos out?
Can you hear me? Unfortunately, I don't seem to be on video, which is probably just as well, but hopefully you can hear me.
I can definitely hear you, so I'll turn my own video off.
Okay, shall I go straight ahead? So I'm going to talk about returning to work and preparing for recovery and building back better, and hopefully we'll be working with CIPD and BITC, Mind and others on the return to work toolkit. So we've got our first meeting tomorrow about this. In terms of, next slide, occupational health, just a kind of quick reminder about what it is. It advises about interaction between health and work, protecting staff from harm at work, and maximise health and well-being. And it can help with return to work after testing, COVID, isolation or illness. So some of these complicated issues for staff who are concerned or have particular physical mental health issues, people who've had COVID, people who had bereavements, for these complex situations, occupational health can help, but clearly in partnership with HR is very important. Professionals are evidence-based, and I think it's in terms of this kind of tightrope between the evidence or the lack of evidence and sort of reassuring staff according to different workplaces, from factories to offices, about what works in workplaces as well. Occupational health can add value, because sometimes, the guidance isn't there. People need reassurance. People obviously are going to be very concerned about their personal risk, and there's going to be all kinds of different issues for temporary returning staff, and there will be evolving guidance that obviously HR will be completely up to speed with, but we can help in terms of the complex issues. Next slide. So we think in terms of general return to work issues that the work environment is going to change. There won't be a return to normality necessarily, much more home working, or it's much slower also return to work, as we saw from the press conference yesterday. The role of leader is very important, just as Neil's been talking about, and Peter too, and those company-wide goals and intentions. And there are particular sort of health issues, be it neurological, cancer, you name it. There will be particular health issues for people as they return to work and their own risks, and there is work happening in terms of particular risk assessments for particular issues that we're involved in. And I'm sure as you're dealing with your teams and staff members, there are different personality types who need support. Some people might not be motivated, some people might be happy working at home, others will just kind of be finding it difficult in terms of readjustment and returning, be it furlough or redeployment. Some people might not want to go to work at all and might want to just do other things, retire, etc. And there will be obviously those serious issues from deaths of loved ones, and extra effort and support obviously is needed. Next slide. I think in terms of the planning and physical environment, people need to sort of think about that early on. If you've got an elevator in your office, that's not going to work for us to all pile into an elevator. What's percentage of an office or workplace is going to be allowed? Will you be working at 50% capacity only? Will there be team 1, team 2, team XYZ, working 1 week on, 1 week off to reduce that risk in terms of sort of distancing? And workplace design, just as EasyJet is, taking out the middle seats, I think people might need to take out the middle desk, and there'll be protocols that people need to put in place, from making tea, having a lunch, using masks. That will have to be worked out beforehand, ideally. Otherwise, there'll be a lot of nervous and anxiety-driven conversations, because there are real risks. COVID is probably not going to go away anytime soon. We know that there's issues not only for staff but also for customers, and just coming back to Corona not going away anytime soon, I think the only virus we've got rid of in the world is smallpox, and I think it's likely that COVID tragically will continue in some shape or form around the world, even though there might be treatments or vaccines available in a year or two. But basically, you know, the return to work conversation, that should be led by the manager. The management leadership is critical. How is that going to happen? Is it going to be sudden? Is it going to be slow? Thinking through that, preparing to return to work, what the first day will look like, what to expect. I mean, I think people will find it, you know, quite difficult to kind of suddenly move back to business as usual, if that will ever continue, actually happen. So next slide, returning to work to mental health issues. I mean, Neil's covered that brilliantly. So it's Peter. I mean, obviously there's going to be real issues in terms of being confident and capable to support people's mental health and well-being. We need to think about job design to help people with that, be it a combination of working at home or being at work. And you know, we know that if people are well led and there's good management, then there's an impact on productivity and competitiveness. So this is not about sort of bleeding heart liberalness. This is about actually it's going to be good for the company. Many returners are going to have depleted mental health, as we know, and this, I suppose, what we find, sort of Peter and others on this leadership council, that we need to follow an evidence-based approach, things like CBT and counselling, employee assistance program, offering that counselling is important. We don't want people to zoom off doing different things that might not have an evidence-based. If they're going to try different approaches to improve mental health, should be evidence-based and data-driven rather than just kind of random. You know, I did a kind of Pilates sort of workout at home, and therefore everyone should do it kind of approach. So again, you know, plug for occupational health. I mean, they are those people who can help with those difficult decisions and working with HR. But that's actually less important than that role of the manager and team working, as Neil said, and good leadership. And if putting it all down in terms of strategy, I think is always good practice in terms of people thinking about their approach to this and self-care. So next steps, I mean, it's always interesting seeing what the government is saying. Obviously, it's very fast moving. Testing is problematic at the moment because of lack of antigen tests that's reliable, but you know, they're working on that as soon as fast they can. I do not recommend companies go out and buy tests at the moment because there's no PHE approved test, and there are some rogue traders out there, and those tests will have false positives and negatives, and it'll be a big issue. So company procurement isn't recommended, and we've stamped down on any occupational health companies who are thinking about that, because they might want to support people return to work through testing, but no test is currently there that's reliable. So return to work, I mean, you know more than I do in terms of when that's going to happen. It's going to be a bumpy ride in May, June, July, staggered approach likely. We are planning a toolkit, hopefully with, as I said, with CIPD and BITC and others. And there is this kind of conflict, isn't there, between managing sort of safety, the reputation of the business, the economic risks. There's different stakeholder needs, and they're not all going to be the same. So you know, that's going to be difficult and has to be effectively led, and through that it's going to be very, very complex. Mask use, I mean, you can see in the papers about that, and you know, whether that's necessary. The Royal Society is looking at it, and SAGE is, I think, in the response today about it. It sounds like it's likely not because of the impact on supply, but clearly some people might want to do it, and there's some evidence that masks is good. Building use, talked about the elevator side, and sharing mental health good practice. So all these kind of things will be in this toolkit, which we're working up to try and help people when the kind of lockdown dates are set. Here's some resources on the last slide from us on the value of occupational health and what it does, just in case you don't know what occupational health is. Okay, I think that's enough for me. I've rattled through. Time for questions. Thanks, Nick.
Thank you very much for that. And just to reassure people, the slides will be going out after the event. You will have a link to this, to the whole webinar, and the links should be applicable to on that presentation. If not, we will also send any of the resource links to resources through with that when the webinar link that we send you. So a couple of questions coming in. I think we'll bring Neil in for this first question, if he's still around. I think there's been quite a focus on trauma from what you were talking about, and people have really related to what you're talking about, trauma. But what are the other mental health trends? And maybe Nick will come in on this as well. What are the other mental health trends that you think will happen as lockdown ends? So trauma is one thing, but what else is going to happen? Is it going to be a pattern? Are there going to be peaks and troughs? Is it, what do you foresee? Tell us the future, Neil.
Oh, let me guess. If I knew that, I would be going to William Hill this afternoon, obviously virtually. But I think I think you have to look at different groups of people, really. So the people who are essential key workers at the moment, I think a lot of those actually there's going to be an element of trauma, and it's not just in the healthcare workers either. We know that many people are making these morally really challenging decisions, and they're just not used to making those sort of decisions in their sort of day-to-day work. So I think we know that morally challenging decisions and moral injury can lead to both post-traumatic stress disorder and depression. But probably in the general population, the biggest issues are probably going to be ones related to financial difficulties and relationship difficulties. And we know that those conditions absolutely go on and increase the risk of suffering from depression or adjustment disorders or a range of anxiety conditions. And of course, in people who've had mental health problems in the past, this stressor is likely to lead to an exacerbation and maybe even a relapse of their ill health as well. So I think although trauma is absolutely front and center for sort of healthcare workers, I think for the population at work as a whole, I think we do need to think more broadly. I also think what's important is mental health services at the moment are sort of relatively quiet, but actually when this all begins to settle into whatever new normal, that there's going to be a bit of a flood and people will be coming in. So I think rather than just thinking about how quickly can I see my therapist, I think communities and businesses do need to think about how we can support mental health at work and in our communities, because there's not going to be 5 million therapists waiting out there to deliver therapy tomorrow. And I don't think also that's necessary either. I think that as we talked about, all three of us, that community feel, that good leadership and that social support actually has really good, strong protective effects on mental health, even in people who've got a formal mental health disorder.
Brilliant, thank you, Neil. And can I bring you back in, Nick, to answer? I mean, there's that question about what it looks like, but also linked to that, what training, and maybe Louise as well. So what training is going to be available? So we're saying it's up to us as managers to do something about this. So what training is there? What access is there for our support so we can support the people around us?
Well, good question. I mean, I think if it's one for Louise, I mean, there's BITC have some excellent training resources coming up. So I might hand over to you, Louise. But I think people will be developing these return to work kind of modules. But I'll hand over to you, Louise, from BITC perspective.
Yeah, thanks, Nick. We're actually in the process of working with you, Nick, in terms of the Society of Occupational Medicine, in terms of developing training packages for BITC members. One, they both have COVID-19 lenses. One is for leaders and senior managers in terms of a lot of the things that we've just been talking about this morning. And the other one is for line managers, and we're aiming to get those out in the autumn. Is in terms of bespoke COVID-19 training, those are the two kinds of products that we've got in the pipeline. But obviously everything at the moment is a movable feast, so you watch this space.
Thank you, Louise. A good question about, I'm not sure who's useful for this one, so come up if you think you've got an answer. I think there's been a clear lead from businesses across the whole response. Businesses led this, and there's been messages from businesses often before government. So who are we to believe in terms of when we come back to work? So the distancing, the masks or not the masks, all these questions people are having. There's been a few questions around this. What's going to be our source of real recommendation? Who's going to be the truth in this one?
Can I say from a Neil point of view, and I won't be very long on it, I mean, I don't know the veracity of all these different experts, but what I do know is that actually there's very good evidence that listening to experts argue about what the truth might be and listening to the media fuel that absolutely creates anxiety. And so I think one of the recommendations for people who are anxious at the moment is not to watch all the news that's going on. So I think whatever the truth might be, we have to rely on organisations like Public Health England and the NHS and the government as our single source of what the truth is at the moment. Otherwise, there is a real danger that actually we're going to get into a debate about what the truth might be and that will exacerbate mental health difficulties.
Yeah, thank you, Neil. Peter, who we're going to believe? What's our source of truth?
It's a great question. I think first of all, the government will give broad guidance. I mean, Nick raised some very particular points about it, but the fact is, different sectors in different contexts may feel that they can move back to, some sort of office-based work or workplace-based work quicker. So it's going to be some very big judgment calls, and I think this is a real time for leadership, and it has been a real time for leadership in organisations to step up. We've got to take on board the guidance, but we've also got to form our own views, our own narrative on this. We've got to consult with and communicate clearly with our organisations, and whatever the guidance is. I mean, if the government said tomorrow it's all fine, everybody go back to their workplaces, as we've all explored, many people would say, well, I'm not going to do it. I just don't think I'm safe. I don't want to travel on public transport. So whatever the rules are, the fact is you've got to put it into your context. You've got to take some leadership decisions about it. You've got to be very, very clear on what you're basing your decisions and what guidance you're giving to your organisation, and listen to them and respond to them. Because I don't think this is going to be about absolute at any point in time in the coming months.
Yeah, can I just add? I mean, I think absolutely that we need to follow government guidance, but the government will be in a slightly awkward position of having sort of amplified risk and then having to rewind to kind of non-amplify risk, and it's fine, let's go back. So it's going to be difficult for them in that stage, and I think that's why you need to kind of walk the tightrope between the evidence base and practice in different workplaces, and that's going to be tough, and that's why we need to be prepared, and we need sort of professionals to advise on specific situations.
I think that's really useful, and there's been a couple of questions actually about transparency. How much do we tell our staff members? And I think that feeds into that, and also the fact that what we know from like the Edelman Trust Barometer is people trust their employers more than they trust anyone else. They trust you as us as leaders more than they trust the government and other institutions. So how honest should we be, and how transparent do we need to be about decision making to help people come back and make the decisions that we can't force them to come back? I think maybe this is yours, Peter, again.
No, I would say that before Nick, that I've always been a very, very strong believer in openness and transparency. And now, of course, there are certain things in businesses that we have to sort of redact. But broadly speaking, this is a real time for openness. And we've all talked about trust. We talked about the psychological contract, about people feeling secure. If they do not think that their leadership is being open and honest with them, then that does not create an environment of trust. And the fact is, we as leaders do not know everything. We absolutely never did. And it's certainly not true now. So it's very, very important, in my view, that we're open and we're honest and we're listening to our people, and we're not forcing things or forcing a pace which people aren't comfortable with.
Thank you very much. There were other questions I'm afraid we don't have time to answer, but there's also been quite a few comments about thanking the speakers, about how useful it's been, how important people have found this. Good to have such a range. Thank you for all of this. Please keep us informed. So very positive response to the people engaging, and we've kept up a significant number of people throughout the webinar, which is always great. Shows that it's been useful. So I will close it as we've always promised to do, is to keep these on time. So thank you very, very much to all our speakers. Really, really brilliant. Everybody will get the link to the webinar afterwards. We have more webinars coming up at BITC. Do check out our main homepage, our website for those webinars, and we'll also send you a link after this one to let you know how to register for webinars coming up, including the one in a week or so, the second in this series with the Society of Organisational Medicine. So that's it. Thank you very much. Please share this if you found it useful. Bye now.
Thanks, everyone. Bye.
Thank you. Goodbye.
Goodbye.